Hi there, my name is Peter Schrey. I'm a physical therapist at Focus Physical Therapy. I'd like to thank the Timbers for inviting me to give you guys a little talk about recovery and how it affects our athletic performance. So I was going to bring up a little presentation here, and we will get started. Recovery to perform. This is something that we've been seeing a lot more in the clinic lately, is some kids kind of pushing themselves pretty hard, ramping up from not doing much, before sports got reopened again, to having to perform at a high level. And we're just seeing if we can try to give you guys a little bit of information about how to optimize your athletic performance and your abilities on the field, with some concepts and principles of recovery that we find in the sports medicine world have been really showing a lot of promise. So obviously this last year has been quite a challenge. We have had, schools shut down, sports were shut down or significantly limited. You probably all are done, trying to run around on the field in a mask, and it's really been some big challenges for us. And so now that things are back open again, we have some new challenges that we need to be aware of. So we're back, and now we're kind of cramming for the exam, so to speak, and trying to make up for lost time and sometimes lost fitness, and that can be troublesome. Schedules are still messed up as far as how often we can practice and when we can go to school. And in some cases, the friends we have at soccer are the only ones that we see if we're doing homeschooling. So it really is, it's quite a nice outlet to be able to get out there with your friends and play. But how does this whole COVID thing tie into soccer, stress, recovery, and performance when you're out there on the field? What we find is that there is some challenges when we try to get back to sports all of a sudden. As you can see with these lines, is that ideally, we have a big increase in intensity when we get back to playing sports, but we have kind of a slower ramp up in the volume. But it's probably what's going to happen, and what we've been seeing happening, especially at the high school level, is going from 2 days a week to 5 days a week practice, is that we see the intensity and the volume are both going up at the same time. And that can be quite a challenge because they're not supposed to spike together. You're supposed to do one or the other. If you look at classic marathon training programs, that's always been the case, is you don't increase both of those at the same time. So it's something to be aware of. The analogy I like to use is cookies. Everybody likes to do baking, and it takes a lot of different ingredients at just the right amounts, baked at the right amount of time at the right temperature for them to taste good. And if you change one, you have an effect on how the others are expressed. Temperature and time are kind of like intensity and when we're trying to play some more. So if we're trying to cook longer at a higher temperature, then what we also end up doing is we try to cook slower at a lower temperature, it doesn't make a very good cookie. And the same kind of thing goes into athletic performance. So what kind of ingredients go into athletic performance and long-term success? And we have a lot of different factors here, and they all are really intertwined with each other. You can't have one be off and expect it to not affect some of the other ones. So think of this as a really interlocking bunch of groups of different things, such as nutrition and cardiovascular fitness, and our mindset and stress, sleep, hydration, and our ability to pick up new sport-specific skills. What do our coaches want? They obviously want us to work hard at practice and be a good teammate. They want you to listen and respond to your coach, have fun, obviously. That's why we're really out there, and to stay healthy. And being motivated to train hard is a wonderful trait that coaches love, and it's hard to teach. But what can happen sometimes is it puts it at risk for some problems. And so one of the things they found in the sports medicine research was that the hours of training per week for a sport, if that was greater than your age, for example, if you're 12 years old and you're practicing 13 hours a week or 14 hours a week, you're 2.4 times more likely to sustain an overuse injury in the next year. Also, if you play the same sport for more than 8 months out of the year, you're 1.6 times more likely to sustain an overuse injury. And another thing that we see a lot in the clinic as well too is previous injuries not being fully rehabilitated or even addressed, and that can do 40 to 70% chance of happening again. So it makes it pretty likely. Another thing that we're concerned about is just, when we get burnt out from training too hard or doing too much too often, we can get injured or just not be into it anymore emotionally. It makes us less likely to want to do the sport. And unfortunately, down the road, it makes us less likely to want to be active the rest of our life. And that's really one of the things that we want lifelong athletes. Even if soccer is not the thing you do until you're 40, we want you to just know that physical activity and being fit is important. And when it comes to injuries, one of the big ones that a lot of athletes, and what we're worried about in the clinic as well too, is ACL injuries, and how long it can take to get back is 9 to 18 months. So quite a long time to be on the bench. So some signs to watch for if you're overtraining is you get an injury. Now, granted, some injuries are inevitable, right? But sometimes some of these repetitive stress injuries that we see are becoming more common than traumatic injuries. You notice that you don't get faster, jump higher, or improve on certain skills that you're working on. You just kind of plateau and you aren't getting better at those things. Start getting irritable with your friends or your coach or your teachers, your family, having trouble concentrating in school, significant weight loss or weight gain. Some alterations or loss of menstrual cycle in the female athlete is something that we screen for and are concerned about, because it tells us there's some hormonal imbalances going on in an athlete that may be not balancing out some of those energies. And also some muscle soreness that doesn't seem to go away. So being pretty sore after a hard workout or a hard game is typical for a day or two, but you should kind of bounce back from that soon. So we want to become a master at the art of recovery. And it's a skill that all athletes should work towards, and that can help us fight off both injury and fatigue. So we're going to talk a little bit more about that using this great concept of math. So stress, we think of it sometimes as a bad thing, but stress is what running hard is, and lifting weights and trying to do box jumps, for example. Those are all physical stresses. If we give some of those stresses, plus we have some recovery, we can have a nice positive adaptation. If we have too much stress and not enough recovery, then the adaptation is poor. And conversely, if we have too little of a stress, if we don't train enough and we have lots of recovery, then our adaptation is going to be poor from an athletic standpoint as well too. And this also ties into our fitness and fatigue. So if our fitness is really high, but our fatigue is really high, our performance won't be good. But if our fitness is high and we're not fatigued, then our performance can be pretty good. And also those basic concepts of nutritional balance as well also come into play with this. So there's a lot of tools out there in the market, and one of them, being over at our clinic, which is inside the Recharge gym, we have lots of these fun tools to work with, which do help. They help you feel better, and we do find that they do help get muscle soreness down and help people recover from injuries, and they can be helpful. Infrared saunas and contrast baths and these Theragun massagers and seeing people on the sports medicine team to kind of help you we're all for that, obviously. However, there are kind of 3 non-negotiable pillars of recovery. And it comes down to nutrition, hydration, and rest are the most effective strategies for optimizing recovery in Olympic athletes. This was from a journal about 12 years ago. And if it's good enough for Olympic athletes, it should be good enough for the rest of us, right? So one of those big ones of those 3 main pillars is sleep. The single greatest, cheapest, and most consistently proven tool in our arsenal. Teenagers need between 8 to 10 hours a night. And getting less than that on a regular basis can be 60 to 110% increased chance of injury just by not getting sleep, even if you're the fittest person out there. And that lack of sleep basically can contribute to poor decisions about food. So they tie into each other, sleep and nutrition, decreased mental sharpness. So we may not make good decisions when it comes to school or even out on the soccer pitch. And one of the things we see in the clinic is a reduced tissue healing capacity. They just don't seem to heal from a injury that we would expect them to heal from sooner. When we do start to sleep well, we release human growth hormone while we're sleeping, and that's kind of in our rest and repair kind of phases of what happens when we sleep, and that helps to rebuild tissues. And it's also been shown that when we sleep well, we can decrease anxiety. So when it comes to hydration, athletes should be aiming for about a half to a full ounce of water per pound of body weight per day. And it sounds like a lot, but if you kind of fit it in with that first glass of water when you get up in the morning and keep sipping throughout the day, you can get in pretty easy. Get in those 50 to 100 ounces if you're a 100-pound athlete. And that amount varies based on how hard you're working and how hot it is outside. One of the ways to know whether you're getting enough hydration during your activity is you shouldn't lose more than 2% of your water weight. So if you weighed yourself before and after a practice or a match. There's a lot of really good information on the sportsinstitute.com's website, where you can find some more information on articles about hydration and concussions, strength training, and things like that. So when it comes to nutrition, carbs are good. They are the quick burning fuels that we need when we're in the middle of an athletic event or training. And great sources of those are fruits and vegetables and whole foods. Vegetables are chock full of all sorts of micronutrients we need, like vitamin D, vitamin A, vitamin C, iron, calcium, things like that. If you aren't sure if you're getting enough of these, then speak to a nutritionist or to your primary care doctor, and they can either get you tested and kind of do a little diet audit and find out kind of what's going on there. Another big thing I see is not enough protein being intaken for athletes that are training, whether it's off season and they're doing some strength training, or on season and they're practicing pretty hard 2, 3, 4 hours a day. You're shooting for about 1 to 2 grams per kilogram of body weight per day. So a 100-pound athlete would be shooting for about 45 grams per day at the minimum. If you're training hard, that could be up to 80, 90. And not all proteins and amino acids are created equally. So amino acids, there's a lot of different ones, and they all exist differently in different foods, meat and vegetable and dairy products. Caveat though is I'm not a nutritionist, but it's my job as a physical therapist to be screening out with some of these questions and make sure people get to the right people if they need some help. And we have a couple of really great choices here in Bend over at Synergy Health and Wellness and at St. Charles Nutrition Services. There's some contact information if you have any questions to reach out to them. So another big thing, and this is something we see a lot when we're rehabbing our athletes and training athletes in the gym or in the clinic, and it should be a foundation of every athlete's yearly program. Typically about 2 to 3 times a week is totally sufficient. When you combine it with all the other stuff like needing to rest, being in your season, in your sports season, taking time to just have free play, just go have some fun, ride a bike, take a walk, jump on the trampoline and some other activities. And that variety of movements that strength training gives us can really help train our neuromuscular system to handle anything that comes up during a sporting event, instead of just being good at running or just being good at jumping. Strength training allows us to activate our muscles, our nerves, builds bone density. But importantly is that the proper programming and technique are vital. So if you are looking at getting into it and you need some advice, there's some great strength coaches and programs here in town that can really get you set off on the right foot, so you're training the right amount at the right time with the right form. And I've been seeing a lot lately is some athletes that are training 5 days a week at a gym, lifting weights, and then in the morning and then in the afternoon going to soccer practice 5 times a week. And that's just not a sustainable amount. You're not going to get the benefits that you need, and you won't actually gain the strength that you need. Heavy load strength training should be done in the off season with lighter weights at less frequency when you're in season. Periodization is this concept of kind of setting up that program so you can get the most benefit out of it with the least amount of risk. So another important factor on that big wheel we saw earlier was stress. And we're talking about emotional or psychological stress. And it's normal to feel some. It's not normal to hold it in. And so it's important that during a crazy year that we've had in the last year, maybe you're on a new team, you got called up a level, you just moved to town, and you're setting high expectations for yourself, that can really start to drain on you. And stress saps our energy, just like physical exercise can as well too. It's important to talk about it with your friends, family, coaches, and if you want some healthcare professionals to help you with that, we'll show you that on the next slide here. And something you can do real simple yourself is just take time to reflect and think about, why was I short with my parents that time, or said that thing to my teammate or my friend that I kind of regret. And sometimes just taking 5 to 15 minutes a day to meditate, which comes in many forms. You don't have to sit there and chant in a dark room with a candle to get the benefits. It could be just taking a walk out in the woods for 10 minutes, or just kind of sitting quietly listening to some music that you like, and just kind of letting your body kind of down regulate a little bit out of that, you know, constant go, go, go kinds of things. Joella and Michael at Cascadia Family Therapy are wonderful, and Katie and her team at Thrive Bend are also some wonderful resources out there, and feel free to reach out to them if you think this is something you'd like some help with. Some other things to think about, we get this question a lot in the clinic, is the use of ibuprofen and Aleve, or what's called NSAIDs, for muscle soreness. Now, yes, they can certainly reduce muscle soreness, but what it ends up doing is when we're sore after activity, it's a sign that your body's tissues got overloaded and they're having a healing response. And that's what results in some soreness and inflammation. And that normal healing response, it's important. And if you take those too much, then you stunt that body's healing response. And so your muscles and bones and ligaments and tendons don't regrow and adapt properly. Long-term use of these can have negative effects on liver, kidney, and heart function. So we want to use those with caution. Just another point to ponder is these compression garments. You know, the research is mixed, but it's kind of a no harm, no foul. If you feel like your calves are feeling kind of tight, or your feet are sore, and you want to put some of those tight socks on, it can kind of help get you out of that soreness a little bit faster. When it comes to stretching, we've also had a lot of advances in the sports medicine research about it, and it may not necessarily improve your recovery, and doing too much of it too aggressively can actually prolong your recovery time, because those muscles and tendons are strained and kind of micro injured from the workouts and the practice, and they need to recover. So stretching, easy, gentle kind of stretching, think like a real basic kind of 15-minute yoga thing can be kind of helpful, but nothing really, really aggressive. So in summary, you know, don't expect too much too soon from yourself, right? You can't heat up the oven faster and turn up the temperature and cook it faster to make it any better. It takes time, and sleep is king or queen, and it's really important you're getting that 8 to 10 hours a night of good quality sleep. Keeping things in balance, thinking about that math equation of stress plus recovery equals adaptation. And it's something you're always going to play around with, and it'll vary from day to day and week to week and month to month and season to season. If you have any questions or concerns, please ask your coach, ask your parents, ask your healthcare professional, and reach out, because you can't help the team if you're sitting on the bench. So thanks again for your time, and take care of yourself. If you have any questions, feel free to reach out to me. And be well. Thank you so much.